Good evening and welcome to this episode of Tubules Live. Today, we are fortunate enough to have with us Mr. Brijesh Patel. Mr. Patel is a consultant orthodontist at Great Ormond Street Hospital and practice principal at the award-winning specialist orthodontic clinic, Orthoclinique in Hitchin. He underwent his undergraduate training at Bristol University and thereafter pursued specialist training at the Royal London. He's actively involved in research, taking a particular interest in the treatment of patients with congenital facial deformities. He has published several scientific papers, contributed in book chapters, and presented both nationally and internationally. He's also involved in teaching postgraduate level orthodontics across the UK and abroad in the management of congenital facial deformities. In specialist practice, he takes particular interest in multidisciplinary treatment of patients. So today, without further ado, I'd now like to hand over the floor to Mr. Brijesh Patel.
Thank you, Neelam and Dentinal Tubules for inviting me today to come and speak about achieving successful anterior aesthetics with adult orthodontics. But before I start, I just wanted to give you a bit of a flavour of the sort of things that I do. As you heard, I spend half my life at Great Ormond Street Hospital and mainly dealing with patients with congenital facial deformity, and these are the sorts of cases that I tend to deal with: first and second brachial arch defects, craniosynostosis, patients who are born with orofacial clefting, and we tend to see these kids from when they're born till they're young adults. And really, to get the sort of results that we're aiming for, the key to success is multidisciplinary working. And what we're trying to do is to get these kids to essentially look as normal as possible, so that they can integrate into normal society. Now, this is actually a Pfeffer's syndrome, and this is the same patient at birth and now at 19 and university, and you can see we can get some really, really good results and actually quite a rewarding job. Now, for the second half of my life, of my week, I spent here at Orthoclinique in Hitchin, and we were quite lucky to actually recently win an award at the Private Dentistry Awards, and we do a lot of adolescent orthodontic work, and so we see lots and lots of kids, but increasingly we're seeing a lot more adults. And the key to treating all these adults is multidisciplinary care, which I'm going to talk about later on. And we're sort of moving on to using lots and lots of contemporary brace work to try and get these patients treated. And increasingly we're also seeing lots of young adults who are keen on having surgical care, and these are some of the cases that we've recently treated in the practice. So today really is an overview of adult orthodontics. Orthodontics especially is quite popular within adults and increasingly more popular amongst general dental practitioners who are providing the care. And what I'm going to talk about is particularly the challenges in treating adult patients and some of the things that I think about when I'm treatment planning these cases. And then I'm going to go through some cases. And today, really, I'm going to just show you all the different things that you can actually do with adult orthodontics and restorative dentistry and max fax and everything else, and not really talk about the specific mechanics, and mainly concentrating on anterior aesthetics. And then towards the end of the presentation, talk about the problems that are commonly encountered when dealing with these sorts of cases. So if we look at adult orthodontics as a whole, this was an article in the Mail about 2 years ago now, and it was actually a reporter that followed a specialist practitioner in the West End. And about half of his cases were actually adult cases. And Ugly Betty made braces quite popular and quite easy to wear, especially the metal ones. And I remember actually having patients coming in saying to me, it was watching Ugly Betty that actually made me consider coming to see you. But if you look at the figures, about half of the adult population is unhappy with the appearance of their teeth, and half of these would actually consider undergoing orthodontic treatment. Now, the problem we have with adult patients is that not all of them have benefited from preventative dentistry. And so if you look at these figures from the Adult Dental Health Survey, you'll notice that actually 74% of all adult patients in the UK have had a tooth extracted, and quite a lot of them have had fillings. And that means there's an additional challenge in trying to get these guys to actually have good aesthetic results at the end of it all. Now, what are the drivers that are actually driving popularity in braces essentially for adults? And actually, if you look at the UK population at the moment, the patient expectation has got people are a lot more aware of their teeth. There's lots more famous people who've had braces, and Mylene Klaas has got a lingual incognito appliance there. And Kate Middleton, she was rumoured to have had lingual braces before her wedding. And the advances in clinical dentistry, both in restorative dentistry but also in orthodontics, has meant that braces are a lot more acceptable. They're smaller, they're inconspicuous, they're pretty much invisible, and the advent of customized braces has meant that you can pretty much do any complicated orthodontic work without anyone knowing you've got a brace on. And then there's this huge market of short-term orthodontics, or what I call speedy braces, which predominantly is marketed to the general dental practitioners, but it actually is a massively growing market. Now, if I just show you some examples of the sort of things we have, on the top left you've got traditional cosmetic ceramic braces, which is what we commonly used in the past. But if you move across to the right there, that's Invisalign, and Invisalign has got so much better now. You've got attachments, you can actually put elastics on. And then on the bottom there, you've got two customized lingual appliances that actually allow you to pretty much do anything you want without anyone knowing you've got braces stuck on. And these are just some of the short-term orthodontic appliances, and there's a whole load out there, and this is just a few examples of them. And as I said, these are designed or marketed mainly for general dental practitioners, and the idea is they're for simple alignment cases where patients don't really want full-blown orthodontic treatment, or where you're planning cosmetic treatment and you want to limit the amount of tooth preparation by actually getting the teeth in a better position. Now, when you're treating adolescents, and there's a key difference between treating adolescents and adults, in that adolescents grow. And this is the same patient before and after treatment. You can see she's changed quite a bit. And as part of that orthodontic treatment, we would plan for that